This is the DocNation Podcast. We are a movement founded by doctors, for doctors, dedicated to empowering medical professionals to reclaim control over healthcare decisions and advocating for their fair share of the industry's resources. Please note, the views expressed are those of DocNation and not necessarily those of our guests or referenced health centers.
I want to start this podcast off by saying, so I'm gonna just talk a little bit about Neil for a second, and then Justin, I'll let you go. But let's start. I'd like to start with saying, hi, I'm Reid Lancaster. I'm a founder at DocNation. Justin's a founder at DocNation as well, and so is Neil. We have another founding partner, Dr. Anthony Gufrida. He wasn't able to make it today, but I just wanted to start out a little bit different today and say, hey, Neil he's in the trenches. And Neil, I just wanted to say, I was going to say this offline, but man, podcasts are supposed to be flowy and real and, you know, not scripted, and we're not scripted. And so I just wanted to say, man, thanks for your support. I've known you for a long time now, but thanks for your support in DocNation. You're a very important founding member, and just tell us where you're at. You know, I think last week were you by a train station or something? And why are you traveling so much? What do you do? Why are you traveling so much? And what got you interested in supporting physicians?
So this is, thank you for asking the question. I'm happy to be here.
Dr. Wheeler, sorry, we start off typically by doing that with you, but I just wanted to keep it real. And I'm just impressed by my partner. So I just wanted a couple of minutes for Neil, if you don't mind.
Love it.
Thank you.
To start off here, I'm at Spine Summit here in Tampa. Right, this is an amazing meeting. It's a huge meeting for spine surgery. There's deformity surgery, but the meeting that I just walked out of is a big lecture hall, tons of physicians in there. It was talking about the future of spine surgery, innovation. That's what gets me going, right? The new toys, the new ways and solutions to help people. In that conversation, he was talking about physician collaboration. He also went on to mention that doctors are not each other's enemies, right? Between specialties. Justin, you love it because he said, Dr. Lanke said, sometimes hospitals are enemies, sometimes insurance companies are enemies, but doctors, we need to stay together. Mm-hmm. It was like a DocNation like advertisement a little bit there. And so I was like, this is exactly where I'm supposed to be. You know, you have those moments where you're like, this is where I'm supposed to be, in this lecture hall. And then when he was done, they started talking about some things, other spine things. And so DocNation is where I'm supposed to be, talking about this exact message. Yeah. So glad to be here with you, Dr. Wheeler.
Awesome.
Thanks, Neil, man. Thanks for your commitment. We wouldn't be here without you. We're grateful for you. All right, Justin, without further ado, go ahead with your introduction of our guest, Dr.
Absolutely.
Wheeler.
Today, we're talking with Dr. Chaminie Wheeler, a passionate advocate for independent physicians and true physician leadership. She's leading the charge to restore trust in medicine by strengthening the doctor-patient relationship, free from the administrative interference that is so common. Dr. Wheeler has been instrumental in organizing independent doctors in Pennsylvania and Lehigh Valley, giving them a stronger voice in patient care. Dr. Wheeler, what inspired you to take such an active role in the independent physician movement?
Absolutely. This is, I love the background right there that doctors do need to stick together. What inspired me, so I, went to medical school, I went to residency, worked in corporate healthcare really my whole life, in large health systems, and you get a census of number of patients you're supposed to see that day, and you do your best. And what I realized is that the longer I worked, the more autonomy I was losing every single day to use the knowledge that I went to school for to do. And how was I losing that autonomy? It was really being lost by regulations and different criteria that were placed on the doctor-patient relationship by individuals who didn't go to medical school.
But aren't regulations good? Aren't they like what we need to have for protection? Like why is that not better for patients and you?
I think some regulations is good, but overall, every healthcare decision needs to be made between the bonds of the doctor-patient relationship. It should be free of all other things. So one of the things like, why do you have to do step 1, 2, 3? If the doctor believes you should do step 4, why can't we do step 4 and get that patient better? If the patient wants to do step 4, the patient is willing to pay for step 4.
Yep.
Why do we need to do step 1, 2, and 3? Because that's the regulation.
And from your perspective, what is the reason, what's their justification for running you through all those extra hoops?
So in
define what regulation means. Like we're we can't go to step 4, but we have to go 1, 2, 3. Why is that? What is the regulation?
One could be even a hospital, hospital in that it makes a protocol that says if a patient comes into the ER with shortness of breath, you order this chest x-ray, and that chest x-ray needs to be ordered before, even though if, say, in your judgment, the patient has been, I don't know, on a flight and you think it could be a pulmonary embolism. Time is critical for that evaluation, treatment, and all of that. But the hospital protocol says we need to do a chest x-ray first. We need to do this. We need to wait for D-dimer to come back before we can order that CT. That could actually be better for the patient. In some cases, we should go through all of those, but not in all cases. So one regulation could be a hospital-driven protocol that's literally there to maybe as a safeguard, but it's really not. I believe there is a lot more incentives and financial gain to do more testing than to do what exactly is needed. Another one could be that's what the insurance requires. The insurance regulatory that says, you know what, shortness of breath, this is the diagnostic code. Therefore, you need to go through step 1, 2, and 3. And therefore, this is the way you need to do it. So it really is, it's not best patient care. And it really interferes with the flow of the entire what's happening in the ER, because you might have been able to triage and get that patient better and out and that bed available to another patient a lot faster if you were free to have the autonomy to make the decision. And you're going to take responsibility for your actions. We have that. So there really should not be that hindrance.
So Dr. Wheeler, if administration and the insurance companies are forcing you to practice medicine in a way that you don't see is best fit, and you are, out of those 3 parties, the doctor, administration, and the insurance company, you are the person with the knowledge, the person executing the plan. Why aren't you making that decision? Why would they make you do those things?
Because we sign an employed contract that says, I am going to follow this. This is what I will do. So that is where I realized to be the best advocate and to have true physician leadership that can transform healthcare is to be independent, so that I am not worried about where my paycheck comes from. Paycheck comes from, what job I do for my patient. And so I'm independent physician, but I'm actually more purist in that way because I'm a direct primary care. So I even stepped outside of the bounds of that insurance regulation in addition to the administration. So in both things, so I have the autonomy to make the decisions that is best. And it's beautiful. I get to actually, even my patient this morning, we talked about how in medical school, we have learned that, 70 to 75% of what's going on with the patient is really taking that history and to figuring it out. Then there's the physical exam, and labs and testing should only be about 5 to 10% of the picture. And why don't we do that? Because 7 minutes it's not enough to take a good history. So we refer to another person, or we order a bunch of tests that didn't necessarily even need to be done. And that skyrockets healthcare. I think in 2023, there was, the US healthcare cost was 4.7 trillion, I want to say. And of that. And so when so in my whole thing is about the doctor-patient relationship. The more distance we put between the doctor and the patient, the more profit that it generates. Because you limit the time between the doctor and the patient to be able to, have that. So you're more likely to write a script. And it incentivizes almost in a way illness. It's easier to, somebody comes in, their blood pressure is high, it's much easier to put them on a beta blocker and send them on their way. It takes 30 seconds to write that, but it would take me 30 minutes not to write that script because I need to talk to them about a lot more and take the liability to have them come back to get that blood pressure rechecked and make sure that it is going in the direction it needs. And insurance billing code may just not cover that next visit or that next visit to get that person better. So it really, our system is incentivized to keep prescribing that pill, maybe add another one to cover the side effects of one.
I'm hearing that insurance companies are incentivizing illness.
Yes.
That's a powerful statement, but that's what I'm hearing, and that's the way I see it as well.
See it. Yeah,
yes,
it's a common theme. Neil, you were going to say something a moment ago.
Yeah, I Reid, you hear that. I hear that too. I also hear that as a patient or a consumer of healthcare, I want to find a doctor that doesn't have to answer to anyone.
I love that, Neil. I love that. Here's why. We don't just need to put it all on the doctors, because doctors are not doing a good job of taking the power back. That's why DocNation exists. We really shouldn't even exist if doctors would just get together and create a collective bargaining group. That's really all we need. We don't even need to start a union. We just need a collective bargaining group that comes together and says, okay, we don't like this, we're going to fight. And we don't even have to fight where the patient, we don't have to, I hate to say this word because people get so scared, but we don't have to strike. Like we don't have to go to that level. We just need to come together and be able to make decisions together and show some sort of power to let the insurance companies know, okay, it's just not as easy as us calling the shots every step of the way. But Neil, you said something I think is really important.
We
go
do
ahead.
have the power. We do have the power because I think about money drives everything, right? And the way that I see it is that every healthcare dollar in our system is paid for by our patients and is generated by a physician order or physician service. So we as doctors, really, we just need to come together and recognize the autonomy we do have. And really, healthcare, medicine cannot exist without us. And we went to medical school to take care of patients, and it cannot exist without patients. So when we have both of those two things on both sides, we just have to recognize that and get behind it and go all in and say, this is it.
I think there are physicians out there who are going to listen to this podcast and say, that sounds amazing. I would love to be in Dr. Wheeler's shoes right now. What are some of the pitfalls and challenges of being a solo or being in private practice? What were some of the pitfalls or challenges that you faced? And people are all thinking, can I even make money doing that? So if I can ask, you don't have to, if I can ask a kind of a personal question is, are the financials okay?
100% they are. And so we have, our office has only been open for a year and a half. And within that year and a half, we have around 450 members. It's my husband and I. So there is a need in society for our patients want a doctor that'll take the time to listen to them and actually take a history, not just write a prescription. I feel like the role of a physician, especially in the, has been degraded to one who can prescribe. And we're more than one who can prescribe.
More than that.
And so the finances are good. Our last two meet and greets we had 20 people. We have done zero advertising. It's all been word of mouth. We don't advertise. And I tell our, I have, other doctors, I said, all you have to do is just do a good job with the patient in front of you. And it's a need. I don't consider healthcare as a right or privilege. It's a need in society that needs to be met. And it should not be met for obscene profit.
That's right.
It's our finances are good. And that's honestly why I wrote a resolution here in Pennsylvania in 2023 to create an independent practicing physician section within the Pennsylvania Medical Society. It was a hard-fought battle, but we were able to create that because in Pennsylvania, about 78% of our physicians are employed, and 22 are independent. And that number is continuing to getting change as our networks continue to engulf our independent doctors.
Yeah.
So our section, this is January 1st of 2025, is officially a section with, I'm actually the board trustee for the independent section within the Medical Society. And we are going strong. We just had a Zoom meeting. We meet every month. Our meetings are well attended, and we have guest speakers that really think outside the box, innovative individuals that help grow. And so it is hard, but it is so worth it because the reward is great. And I mean, I'm a pediatrician, so I do tend to live in the land of unicorns and rainbows, but I really believe the independent movement actually is gonna be the solution to healthcare. Doctors taking back autonomy, and we have a lot of good things in play. My husband and I just hosted a gathering earlier in the month in February. We had 47 doctors who drove from all over the state who came. We talked and we united. We have a group in the Lehigh Valley that we created. There's about 70, some are physicians, some are non-physicians like chiropractors that are on it, but we have a group of about 70 with all kinds of specialties with our own, that is just our whole goal is, so we have two large health networks in the Lehigh Valley, St. Luke and Lehigh Valley Hospital. So our patients, and we don't have the deep pockets to be able to put a billboard on every corner. So we want to give our patients choices though. So we came together, and our goal is that our patients can have a choice where if they want to go to a St. Luke doctor, they can, Lehigh Valley doctor, they can. Oh, and there's another website of independent doctors. Maybe I'll go to one of them. It's really, it's free market, increasing choice, price transparency. We got this.
I love how fresh this is.
I know, this is amazing
like a
to
year and a
hear.
half, you said. And for people that are afraid or think they can't do it, you're living proof that it's possible. I'm so proud of you, Dr. Wheeler, what you've done. I was digging around a little bit, doing some research, and I got to see you stand up for yourself and for your practice and for your patients and so many people when you were interviewed by the news and took a stand for what you believe, which is patient choice and physician choice. Like, this is what's so awesome about DocNation, is that we get to bring together so many leaders that are doing big things. It's hard. Sometimes, you're so busy with your head down that you don't really know what's going on around you. And here we are. You are changing the game, and you're taking on the Goliath here that exists, and it's working. And it does work.
It is. It's working because it's what's good. It's good. Like for me, when you said on the news, it was such a hard time. I'm a pediatrician, have been a advocate for vaccines my whole life. I've taken, I've done spinal taps with kids with vaccine preventable and kids who are vaccinated with meningitis, so I've seen both sides. I've seen the working in pediatric ER, and when healthcare decisions were being made and just really forced upon people, for my my colleagues and the nurses, and everybody was just not saying anything. It was so hard for me. I was like, you know what? We need to take a step back. During RSV season, we always wore masks and gowned and gloved and went in to take care of our little babies, right? That's what we did. Before we left the room, we took everything off and put it in a bin. And now I'm told that I can walk around the hospital wearing the same thing, and it's okay to go from a patient room to a patient room, something I've never done. And it's supposed to be okay. And I'm not supposed to ask, is that okay? why does that make sense? I am literally not supposed to say that. And so I'm like, look, I know everything is new, and I honestly don't know where everything is the right decision or not, but I know we cannot be forcing things on people.
Yeah. Yeah.
You know,
So amazing.
it is. It's good. We took and it's a great journey. I mean, there are independent doctors that are in all different specialties. We actually have been able to advocate in the state of Pennsylvania to decrease the strength of the restrictive covenant restrictions in Pennsylvania in healthcare. We got legislation our governor signed last summer. So that was it's not exactly what we wanted, but it's better than what we had. And we chose direct primary care because it really is concierge medicine, but it's not concierge prices, and truly does work. And I really do think the direct primary care movement, where we can expand HSA to increase choice for families, and all of those will just really take off and transform healthcare to really be back to restore that covenant of trust in medicine that we really need.
I think my favorite thing that you've said so far is that it's working because it's good. And I translate that to say it's working because it's the right thing to do. It's the right way to do medicine.
Mm-hmm.
And that's so refreshing to hear. But I also hear you saying this direction and this focus and my advocacy is not easy. And I got to be honest, DocNation and our focus is not easy. You know, it's a challenge. We're fighting. We're trying to get people together. We're going against administration and regulation and legal stuff. And so it's like we have a sister in arms here. And I'm just encouraged today. You're going through all these battles, yet you have a nice smile on your face and you're focused because you know that what you're doing is the right thing to be doing, and it's working, and it's the good thing to be doing. So I just want to say thank you so much for doing everything you're doing. And DocNation is here to support you in any way that you could see fit.
I would love it. I mean, whatever that we can do to collaborate and help, and really, it's not about just independent, I don't know if you saw on our website, but I firmly believe it that, independent doctors are the best choice for patient advocacy, because you can actually say what you're saying in a hospital setting. And not only that, we're the best advocates for our employed colleagues, because we can advocate where they can't because of their contracts. So we are here for our employed colleagues, and for our patients, and for each other. So you're right. We have got to be in the same sandbox and get along and say, let's move forward.
I would want, like, the person that's on my team to be able to say the truth and do the right thing. I would want my doctor to be able to tell me the truth and say the right thing, and say the right thing do the right thing right now. I love what you're saying. I'm inspired by your work. I'm a fan now. So thank you.
Thank you. I would love it if you guys ever, wanted to do in Pennsylvania, part of our independent physician section group. I mean, it's really energizing. It's the reason it's not moving faster is because we're independent. We have to take care of the business of medicine in addition to our patients.
That's right.
Just not enough time.
That's right.
But
that's right.
Otherwise it would be moving faster.
We totally go ahead, Justin.
There's at least one thing that we need to do after this, and that is we helped a dermatologist start his practice in Pennsylvania, and he is doing really well. We need to get him connected with you. So maybe he's already connected with you. I don't know. We'll find out afterward. Let's make sure that we do that.
Dr. Wheeler, one of the things we do is we help manage private practices and start private practices.
Okay.
Because we see that is a way to freedom. And when I say freedom, I truly mean freedom. Physicians are not free. They go to school, they work so hard, they become elite, all to be shackled. Their decision making, their knowledge, their experience is not flourishing because they're shackled by administration and insurance companies. And so we help start practices, but that it takes a long time. It takes a long time. And so that's why we started the advocacy side. to do more,
That sounds wonderful, because we started our DPC, and I can tell you, just in 2025, I have had 5 physicians reach out to me about how they can leave. And
There you go.
I just share our story, and I'm willing to, but like those would be great resources, because they want to leave. They want to, not be shackled. They want to make those decisions.
We've been helping doctors leave for 15 years.
That's wonderful.
So do this. Will you reach back out to those 5 people and just send them over to us, and we will help walk them through the process.
Okay.
Okay.
I
Wow,
will
I
definitely
really feel like we have a sister in arms. At some
Yeah.
point, I want to meet your husband. Tell him thank you for all the work he's doing, because we know it's a team effort, and we'll be in touch.
Thank you.
Thank you so much.
Thanks, Dr.
Awesome.
Wheeler.
This was fun.
This is fun. You're awesome.
This has been the DocNation Podcast. If you like what you heard, be sure to subscribe, rate, and leave us a review on Apple Podcasts, Spotify, or wherever you are listening to us. Your feedback really helps us reach more listeners like you. We'd also love to hear your thoughts and any topics you'd like us to cover in future episodes. Don't forget to follow us on Facebook, Instagram, and LinkedIn for updates, behind-the-scenes content, and to join the conversation. Thanks for listening.